Hello everyone, good morning. I am Sanjana, nutritionist from ZenOnco.io. Today I shall be discussing about the topic bone marrow transplantation and its importance in nutrition. So first of all, let us understand what are hematopoietic stem cells. Hematopoietic stem cells are the ones from which all the blood cells will evolve. Now we know that bone marrow contains the greatest concentration of the blood cells. So, hence, generally, uh, bone marrow transplantation is carried out. Now, there are three kinds of transplantations. So, the first type is autologous transplantation. Autologous transplantation occurs and is done by using the patient's own stem cells. Next type of transplantation is syngeneic transplantation, which is obtained from an identical twin. And next is allogenic transplantation, which is done from an unrelated donor. Now, hematological malignancies, which commonly are your leukemia or lymphoma or multiple myeloma. So, these are the main indications for a stem cell transplantation as well. Stem cell transplantation can be carried out both in adults as well as the children. So, how is the procedure in brief? I will tell you. So, first of all, a patient who has been, you know, taken into consideration for a bone marrow transplantation will be having aggressive treatments or therapies of chemotherapy and radiation, because of which the immune system will be highly compromised. Now, after the transplantation also, the patient will be having neutropenia and the nutritional status will also decline rapidly. This treatment is extremely aggressive and it also has certain side effects. So now if you go to see the main complication which we come across in patients who undergo a bone marrow transplantation is reduced oral intake, and sometimes it can result in short-term tube feeding, especially in children who undergo this transplantation. Now let us understand as to what are the objectives of pre-transplantation versus post-transplantation. So objectives for a pre-transplantation is it is very important to have adequate nutrient stores. Yes, a well-balanced diet has to be planned out for the patient, in which they have vitamins, minerals, proteins, and the food is also having adequate amount of ingredients which also have antioxidant and anti-inflammatory properties as well. It is also very important to take a detailed nutritional assessment of the patients who have been selected for a bone marrow transplantation to understand the nutritional risk and to give timely intervention as well. Also, you need to check also if assess for the adequate hydration stores. It has been seen that supplementation of omega 3 is also beneficial, as it will help them in improving their energy levels, it will help them in reducing the complications, and also it will help in reducing inflammation as well. Next is the post transplantation. Post transplantation is very important because the main objective of this is that we need to ensure that we prevent the risk of infections and also certain gastric issues which might occur as a side effect of the post transplantation. We also need to ensure that we help them manage the side effects or the symptoms, which commonly could include nausea, vomiting, or diarrhea, fatigue as well. We need to help them improve their appetite, and we also need to ensure that they have adequate nutritional status. Next, we also need to help in improving their weight gradually as well. and we need to take measures and steps to help them also to improve their quality of life. Now, the next part of the discussion I will be going into is what diet is important for the patients who undergo a bone marrow transplantation. Now, post transplantation, the body of the cancer patients is extremely immunocompromised. Their immune system is extremely weak and they are prone to have a risk of catching infections soon. So hence we need to ensure to give them a low bacterial diet or a sterile diet, which is called as a neutropenic diet. Now, when I say neutropenic diet, why is it important to include a neutropenic diet? So the thing is, we need to reduce the pathogens which are there, or the pathogenic compounds, organisms which are there, so that it will also help in reducing the gastrointestinal issues which occur in the immunocompromised patients. And also we need to ensure that to give them new additional nutrition support at times. So what could happen is, as a post procedure complication, sometimes they can have persistent nausea or vomiting, due to which they will have a reduced intake as well. So during this time we can give them NJ feeds, which have been shown to reduce the nausea and vomiting as well. If they are having a if the doctor will suspect that there is a gastrointestinal failure, then alternative feeding routes such as enteral or parenteral nutrition need to be initiated as well. Now, the energy requirement for the patient will be 30 to 35 kilocalories per kg body weight, because we need to ensure that we are going to help in helping the patient to improve their weight. Also, we need to help them to reduce the risk of infections, and there has to be a close monitoring of the patient done to ensure that we put them at a low risk against graft versus host disease. Now, generally, when we say about fat intake, so the fat intake, as we say, is 25 to 30% of the total kilocalories. Generally, MCT oils or the medium chain triglycerides is well tolerated, because these help in giving quick energy to the body, and they also help in the easy digestion of the fat. Now, sometimes post the bone marrow transplantation, there could also be wherein the patient is sometimes on a corticosteroids therapy. Now, during this time, it is very important to check the glucose levels as well, because they are at a risk of having steroid-induced diabetes. Now, suppose sometimes when they do a routine test and they find that the patient is having raised glucose level, it's very important to also control their carbohydrate intake and make modifications in the diet accordingly as well. So now when I speak about the coming back to the neutropenic diet, we need to ensure that we give the patient well cooked food and no raw food has to be given. Most importantly, we need to ask the patient to clean hands and wash them thoroughly before doing any activity or before even having the food as well. The food has to be kept at a temperature wherein it will reduce the risk of food infections. And we need to ensure to microwave the food before giving the food for the patients to consume as well. Next, we move ahead to see what foods need to be avoided and how we can maintain the food hygiene and the safety. First of all, undercooked fruits or vegetables or even food should not be given to the patient. Okay, and we also need to ensure not to give any outside food, because the outside food, it's a questionability of how fresh is it, what ingredients have been used, because it can also cause gastric disturbances or gastric discomfort to the patients, as they are already immunocompromised. Also, we need to ensure not to give them any raw vegetable sprouts, or maybe say raw salad dressings or stir fry fried vegetables or fruits. So we need to ensure that everything is thoroughly well cooked. So, everyone, to conclude, yes, it is very important to follow a neutropenic diet post a bone marrow transplantation. One, it is going to help in reducing the chances of infection. Next, we also need to ensure that we are providing adequate nutrition to these patients so that it will help to improve their overall health, and it will also help them to gradually build their immunity and strength. And then we can also help them uh, to improve their quality of life as well. Thank you so much for watching this video. We at ZenOnco are always by your side, offering support and guidance as you navigate through your cancer journey. For help regarding cancer, you can surely connect with our cancer coaches on the below mentioned number. Stay tuned in for more videos which I'll be posting on this topic soon. Thank you.